Welcome to the office. This is the way not to do an chiropractic adjustments. I'll explain you the reason. So between the cervical spine, two very important artery named the vertebral artery passes. The vertebral artery goes and gives blood supply to the brain. When we are doing rotatory chiropractic adjustments, there is a high chance for this arteries to get compressed, and that can cause severe reduction of blood flow in the brain, and which can also lead to stroke and paralysis. So I will now teach you the right way to do a chiropractic adjustments for the neck. Teach you the correct way of doing a chiropractic adjustment. First you need a chiropractic x-ray for this. Come here, show the x-ray. Okay. So we have already marked those x-rays, and from there we can, through those markings, we can find out which is the exact vertebra that needs to be adjusted. Even though if I adjust in this cervical region, it will make sound, but this is not the region that needs to be adjusted. The region that needs to be adjusted is C7, because we have done the x-rays and we exactly know which vertebra is subluxated. That needs to be adjusted. Again, we have a sagittal view and a frontal view. So from there we know all the three axes where the vertebra has subluxated. Postcode. So in this case, the vertebra is subluxated backward, and once it has subluxated backwards, it's side bend, the C7, and side bend to the right, and then rotated to the right. So we have to do an three-dimensional adjustment that gets the vertebra back into position. Okay, and this is very safe, because when you're doing adjustment like this, I'll demonstrate the way. I'll demonstrate a safe way of doing a chiropractic adjustment for the cervical spine. After doing the X-ray analysis, the next thing that we use is a nervoscope. It's a delta T model, and from there we go up to the cervical spine, and wherever the vertebra is subluxated, we can see a reading in the meter. So from there we already know through the X-rays and through the nervoscope reading that this is the particular area of subluxation. From there again we will do some motion palpation to collaborate with our cervical X-ray as to which side the bone has rotated, in which degree and how much. So once we have that, so we palpate and confirm our X-ray diagnosis and nervoscope diagnosis. From there, this is a Gonstead chair, cervical chair. And we strap the patient. So from the X-rays, nervoscope analysis and motion palpation, we already know this is the 7th cervical vertebra which is subluxated backwards to the side and rotated like this. From there, we'll palpate, we'll get there, we'll extend, side bend, and then make a thrust. See, the main thing is what we are trying to do is trying to get the vertebra back into position. It's not about making sounds and all. It's about getting the vertebral subluxation back into position. So if the vertebra is subluxated back, side bend, you need to do an adjustment that gets it back into position. It's not about making sound. And the most important thing is to adjust the vertebra which are subluxated. What most Indian chiropractors are doing is making sound, but doing adjustments at the wrong segments, which is actually causing more problem to the patients. It actually increases the pain, and especially in case of cervical spine, if you are doing wrong techniques and wrong adjustments, it can compress your vertebral artery, which supplies blood to the brain. That can eventually lead to stroke, even weakness in your hands, arms, tingling sensation. So avoid chiropractic from quack people. This is what we do is specific Gonstead chiropractic treatment, where we mandate that patient should have specialized chiropractic experts. We make sure we are doing nervoscope analysis so that we are able to find the exact vertebral subluxation. and then we do the techniques very safely. We are not doing rotation like this or like this and making sound. It's a very specific adjustment on that position. It's not going to make a lot of sound, but what it does is actually correct the subluxation. That is the main idea of chiropractic. It's not about making unnecessary sound, which you'll see in Indian chiropractic videos. Okay? Thank you. Experience the Gonstead difference.